Hello, my name is Callie Poulin, and today I will be talking about the effectiveness of treatment with silicone gel sheeting and corticosteroid injections on minimizing postoperative keloid scars in human transgender adults who have undergone female-to-male chest reconstruction surgery in the past 5 years. The top image on the right shows keloid scarring as a result from chest reconstruction surgery, and the bottom image shows the same keloid scarring after silicone gel sheeting and compression therapies. Here's a roadmap outlining my presentation, starting with the motivation of the greater problem. Transgender and non-binary youth face elevated risk for depression, thoughts of suicide, and attempting suicide compared to youth who are cisgender and straight. According to the Trevor Project, LGBTQ youth are more than 4 times as likely to attempt suicide than their peers. Lastly, the 2022 National Survey on LGBTQ Youth Mental Health found that 45% of LGBTQ youth seriously considered attempting suicide in the past year, including more than half of transgender and non-binary youth. The image on the right shows that 78% of transgender individuals had improved psychological functioning after receiving gender-confirming treatment, in addition to the suicide rates in transgender individuals significantly decreasing. There's an increasing amount of gender-affirming surgeries being performed in which chest reconstruction surgery, which is also known as top surgery, is usually the first surgical procedure. If an individual is prone to keloid scarring, they may experience gender dysphoria, which is the feeling of discomfort or distress that occurs in people whose gender identity differs from their sex assigned at birth or sex-related physical characteristics. There is minimal information regarding keloid scarring for top surgery, so these patients do not have resources to educate themselves. Further research could allow for an effective treatment to be discovered, and transgender patients could improve their quality of life by minimizing the gender dysphoria that they experience. Next is the background of science for the proposal. Keloid scars are scars that are thick, discolored, and raised. These scars can cause tenderness, itching, pain, stiffness, and psychological distress. They can also spread to other areas of the body and continue to grow for years. There is evidence that points toward keloid scars being genetic, therefore it may be possible to eliminate someone developing keloid scars after surgery. Even though it may be impossible to completely eliminate keloid scarring, there has been research conducted to reduce the appearance and symptoms of these scars. Current treatments for keloid scarring include surgery, cryotherapy, radiation therapy, silicone gel sheeting, compression therapy, and various types of intralesional corticosteroid injections, which are all pictured on the image to the right. There is state-of-the-art technology that helps with this problem, however, there are still knowledge gaps. Studies have explored non-invasive and invasive treatments, which include silicone gel sheeting and intralesional corticosteroid injections, respectively. Corticosteroid injections are typically the first method of treatment, and they are used either alone or in conjunction with other treatments. These injections have been shown to improve scar pliability, diminish scar volume and height, and lead to rapid improvement of symptoms such as itching and pain. Silicone gel sheeting studies have shown up to 90% improvement of keloid scars in patients that wear silicone gel sheets on their scar site for 12 to 24 hours per day for 3 to 6 months. There are studies researching keloid scars, but there is no consensus as to which treatment is the most effective. Keloid scars that result from female-to-male transgender patients after top surgery has not been previously researched, therefore these individuals do not have adequate resources to educate themselves. Research in this area would allow patients in this demographic to know more about the effective treatment options, in addition to further educating physicians about the best options for their patients. This would have reduced the knowledge gap of the severity of gender dysphoria in female-to-male transgender patients. Further research on these treatment options to treat keloid scarring from chest reconstruction surgery would minimize gender dysphoria and lead to an increased quality of life. My research approach to this proposed work is organized into 3 different aims or experiments. All these experiments, I would target female-to-male transgender patients that have received top surgery within the past 5 years. They would need to have keloid scarring from this procedure without any prior treatment. Previous studies have shown that a sample size lower than 20 does not yield conclusive results, so I would conduct these with a sample size larger than 50 individuals. These individuals would range between 18 to 30 years old, in addition to various locations, races, and ethnicities to ensure a diverse demographic. For the first experiment, there would be a control group that does not receive any treatment. This would show if there was any scar growth or reduction over the time of the experiment. The other group would consist of patients who undergo silicone gel sheet treatment using a flexible sheet that adheres to the skin and allows moisture and oxygen to pass through. The sheet is made up of a cross-linked polymer, which is a medical-grade silicone. It is combined with a silicone membrane backing, which increases the durability. These patients would wear this silicone gel sheet on their scar site for 16 hours every day for 6 months. The dimensions of the scars would be measured and patients would fill out a questionnaire each month. This questionnaire would include rating symptoms and their quality of life using a standardized numerical scale. From these results, the most effective treatment based on scar size reduction and minimizing symptoms could be concluded. For the second experiment, another control group would receive no treatment. The other group would receive intralesional corticosteroid injections. Triamcinolone acetonide, also known as TMA, would be used, which is the most common type of corticosteroid injection. Studies have shown that TMA decreases the recurrence rates by an average of 50% and is effective in reducing the scar volume. The dosage of the injections would vary from 10 to 40 milligrams per milliliter, depending on the size of the scar. These injections would be administered every month for the course of 6 months. The dimensions of the scars would be measured and the patients would fill out the questionnaires each month, just like the first experiment. For the third experiment, another control group would receive no treatment. The other group would receive a combination treatment of silicone gel sheeting and intralesional corticosteroid injections using TMA. These patients would receive the injection once every month for 6 months, in addition to wearing a silicone gel sheet on their scar site for 16 hours every day for the same period of 6 months. The same dimensions would be measured and the same questionnaires would be used as the prior experiments. Finally, a summary of the entire research proposal. These experiments could determine what treatment plan reduces dimensions of keloid scarring from top surgery and the severity of symptoms. This improvement of scar appearance would allow female-to-male transgender patients to experience less gender dysphoria than previously, leading to an improved quality of life. Due to the increasing amount of gender-affirming surgeries being performed, this would further educate physicians on choosing the best treatment for their patients. These experiments could also further educate the scientific community regarding treatments for other procedures, such as mastectomy scars from breast cancer, in which these patients may experience a decreased quality of life due to their appearance. Therefore, these experiments would greatly benefit not only the lives of female-to-male transgender patients and their loved ones, but also the scientific community as a whole. Again, this proposal is for the effectiveness of treatment with silicone gel sheeting and corticosteroid injections on minimizing postoperative keloid scars in human transgender adults who have undergone female-to-male chest reconstruction surgery in the past 5 years. Thank you for your attention, and I look forward to answering your questions via my Canvas discussion thread.